Everybody, my name is Dr. Darren Candow, and I will be presenting here, looking at the effects of creatine on aging muscle, bone, and potentially the brain across the lifespan. There's my Instagram handle if you'd like to follow it at Dr. Darren Candow. Again, I'm a faculty member and professor in the Faculty of Kinesiology and Health Studies at the University of Regina, actually here in Canada. So there's my disclosure. I've conducted industry sponsored research, but everything I'll be talking about today is based on evidence-based research looking at the effects of creatine, primarily monohydrate, across the lifespan. So as most of us know, creatine is actually made in the human body. It's made primarily in two areas. I'm sorry. The main area, obviously, it starts in the kidney, and then it's actually synthesized primarily in the liver. But the other area is in the brain. So please note that skeletal muscle, which houses the majority of creatine, it actually doesn't make creatine. Creatine is primarily synthesized endogenously in the liver. The process starts in the kidney, and primarily from three amino acids, arginine, glycine, and methionine. And again, that process also occurs in the brain. And we'll talk about the disconnect between the muscle and the brain a little bit later on. You can also get creatine through food sources. It is very difficult to do nowadays, especially with a lot of food insecurities. Creatine is primarily found in animal-based products such as seafood, or red meat. There's trace amounts in dairy, but really, if you're consuming creatine on a daily basis, red meat or seafood, you're probably getting a small amount, enough to maintain potentially activities of daily living. But we're going to talk about some of the benefits of having a little bit more in the body. So again, this is in addition to your natural production in the liver and brain. This is where it gets into the difficulty why we think supplementation might be a little bit more attractive. You can see here that to get as little as 3 grams of creatine, you would need to eat an entire kilogram of codfish. To get 6.5 grams of creatine, you'd need to eat an entire kilogram of herring and so on and so forth. So for those that are vegan, vegetarian, or emphasizing a plant-based diet, it's going to be near impossible to get additional dietary creatine. For those that do emphasize an omnivore or a carnivore diet, you can get dietary creatine through your diet. You combine that with your endogenous synthesis, and that would give you a small surplus. I guess the question comes, is that combination enough to promote or provide some of the health benefits that I think a lot of people are well aware of? So we're big proponents on creatine monohydrate. The key here is that supplementation form, monohydrate meaning creatine is simply linked to water. And when this molecule goes through your GI tract, the water molecule is simply dissolved in the hydrochloric acid and other acids in your stomach. But creatine is very unique. It's actually resistant to the very low acidic environment of the stomach. Creatine seems to degrade over time at a pH of about 3 to 4. Your stomach is a lot lower, so that's why creatine seems to be a little bit more stable. So therefore, creatine remains intact. When it goes through the GI tract, and of course, then when it enters the blood, it's very similar to what's being produced in the liver and the brain. And that's probably why creatine's safety profile is so exceptional. The body recognizes it if it is creatine, and then utilizes that for a number of processes. Going all the way back to even your high school science classes, you'll remember, if you will, I'll just move my face a little bit more, that creatine is basically being involved in high energy phosphate metabolism. Not to bore you too much with a lot of detail, but if you can remember that the creatine kinase reaction is a multidirectional process. So if you have more creatine coming in through the diet, naturally being produced in the body, in the liver, brain, or through supplementation, you're elevating your body's creatine concentration. And of course, through the creatine kinase reaction, that's going to simply move this direction from right to left, creating more phosphocreatine. Why is that a good thing? Well, more phosphocreatine will then drive the reaction from left to right. Create phosphocreatine will then combine with adenosine diphosphate to help maintain ATP levels. ATP is needed, or the energy currency of all our cells. So when you're exercising, playing soccer, tennis, whichever it is, We need to make ATP in our muscles to perform muscle contraction. And so essentially phosphocreatine in subsequently from the amount of creatine coming into the body is elevated. That seems to maintain ATP a little bit longer. So if you see here on the right, when you have an elevated amount of phosphocreatine, it's sacrificing itself. In other words, creatine is coming to the rescue to help maintain ATP longer. So how would this graph look if someone was on creatine supplementation? Well, we think not only would the amount of creatine or phosphocreatine be near 100%, but the blue line would be extended. In other words, this individual could exercise to exhaustion a little bit longer. To the average person, that is important. To a world championship athlete or a recent Olympic athlete, that is crucial. Probably the big difference between a gold medal and not medaling at all. So you can see here they have a rapid rate of exhaustion around the 10-second mark on creatine supplementation. Maybe this line is pushed out to 12 or 14 seconds, enabling the individual to exercise at a higher capacity. And we think if you're a weight trained individual or engage in anaerobic type of sport, those individuals can perform more repetitions, get stronger, and have greater fatigue. And over time, this is probably why individuals on creatine supplementation can get bigger, stronger, and faster. Please note that the vast majority of all the evidence-based research on creatine monohydrate supplementation is in combination with resistance training. There's a few studies which have been shown to have some exercise benefits with creatine by itself. There's probably more health benefits from creatine by itself, but the vast majority of its potential, from an increase in lean tissue mass to an increase in performance, is all based on creatine in combination with weight training. And we'll talk about why we think that is shortly. So one of the biggest focal points of creatine supplementation is the ability to improve lean tissue mass or muscle mass. And especially as we get older, around the age of 50 and above, we really go through type 2 muscle atrophy, which predisposes us to something called sarcopenia. Sarcopenia is a general classification. It's now considered a disease of aging, but it's generalized by a reduction in muscle strength, lean tissue and muscle mass, and of course, functionality. And one of the big things we're trying to focus in is, can we improve muscle quality or relative strength? That means the amount of muscle mass you have in relation to strength. Could this allow an older individual to live longer free of disease? And I was fortunate to work with a great colleague of mine, Dr. Phil Chillibeck. And when we looked at the largest meta-analysis to date, now this was published in 2017. There have been a few more studies added to this, or that need to be added, but I don't think it would change the results. If anything, I think it would substantially bolster the results. But we looked at 22 studies looking at older adults, 50 and above. And we were very fortunate. That means that only over 700 males and females, the females were primarily postmenopausal. They were randomized to creatine supplementation or placebo. But the important thing here is, remember that they were combining this with resistance training on average about 2 to 3 sessions a week, which is very common, all the way up to a year. And what did the results show? Just move me down here. When you look at the totality of research, again, there was a select number of studies, but again, adequate sample size, that when you look at all the data and collapse it, these measures, when we were looking at lean tissue, were by DEXA, bioelectrical impedance, BOD-POD, or underwater weighing. Those individuals, again, 50 and above, that combined creatine with resistance training, they experienced a 1.4 greater kilogram increase on whole body lean tissue mass compared to those on placebo. Keep in mind, the people on placebo were still resistance training. So in other words, when you combine creatine and weight training, it seems to have a muscle or an anabolic effect to the body. There is a little bit of disagreement or controversy over measuring lean tissue, because as you would know, lean tissue encompasses blood, organs, connective tissue. So it's not 100% muscle mass, but there was a few studies performed out of Europe looking at the differences in the composition of lean tissue mass, and it's been concluded, not 100% accurate, but concluded in general terms, that half of lean tissue is pure muscle. So at the end of the day, we can conservatively say that, creatine and resistance training would probably increase 700 grams of pure muscle to an older adult. And I think that's very, very positive and beneficial. Keep in mind, these individuals are reducing muscle and lean tissue mass as they get older. So this lifestyle intervention of resistance training and creatine seems to come to the rescue. What about a greater measure of muscle quality? And this is where we use CT scanning. So now we're able to go more inside the soft tissue and look at the differences or the density. This study was done, we published this a few years ago, where we had 53 participants, again, 50 years and above. They performed 1 year of supervised resistance training about 3 times a week, and they took creatine or placebo. And the dose here was in relative terms about 0.1 gram per kilogram. So on average, these individuals were about 80 kilograms. So 80 times 0.1 is about 8 grams a day. So much more than what we usually recommend for a younger population of the 3 to 5 grams. We want to give a little bit more to see if it had any advantageous effects. And this is quite interesting that when you look at muscle density by peripheral quantitative CT scanning, an entire year of weight training and a higher dose of creatine, again, about 8 grams of creatine monohydrate, these individuals had an increase in lower leg muscle density, whereas those on placebo had a slight decrease. So again, this is critically and potentially clinically important because lower leg muscle density below the knee is a main indicator of offsetting falls and potentially fracture later on. If you have stronger tibialis anterior muscles, stronger gastrocs and soleus muscles, when you were to slip or fall on icy roads or on the carpet in your house, whichever it is, these individuals may be able to withstand falling and, of course, offsetting fracture. We also wanted to look at regional increases in muscle size with aging, and I worked with world-renowned colleague Dr. Brad Schoenfeld here on resistance training, and we started to look at some studies that specifically looked at limb muscle size, and this was primarily done with an ultrasound machine. So this would be your bicep, tricep, quadricep, hamstring, and the calf muscles. Overall, about 280 participants were involved in this narrative review and meta-analysis. Sample sizes did range, so there is a little bit of caution and limitation, and of course, 6 studies were involved. But what we concluded with a very small effect size is that creatine and resistance training can improve limb muscle size. And this might have application for those individuals, wanting to improve upper body muscle size or lower body regional size. But at the end of the day, I think what it says is that exercise and creatine can cause a small beneficial effect to individual muscles within the body. And I think this could have application, for example, stroke rehabilitation, where one side of the body may be more negatively affected or jeopardized compared to the other. Maybe those certain limbs that are having more adverse effects can get some beneficial effects from creatine and, again, resistance training. Moving now on to strength, and I think this is probably more important from a functionality and lifelong perspective. Again, going back to that meta-analysis I previously mentioned with Dr. Chillibeck, when we looked at the entire body of research, this was quite interesting and encouraging. When you combine creatine monohydrate and resistance training, those individuals got a significant greater increase in upper body strength and lower body strength. So in summary, they got an improvement in total body strength. So we've already seen an improvement in whole body lean tissue mass. Half of that was probably muscle. And now we're getting into some more functionality or applications for daily living that creatine and resistance training will improve upper and lower body strength in older adults. And we think both are important, but we really wanted to focus here on lower limb strength because we think it's clinically significant. We did a study in 2005 where we clearly showed that as we get older, lower body muscle groups are more negatively affected with aging. There's not a real good mechanistic answer for that, except that the largest muscles are in the lower limbs and they undergo type 2 muscle atrophy as we get older. You've probably heard of the denervation, renervation process. Maybe as we get older, we don't use these limbs at the same intensity. Maybe older adults don't eat as much red meat or seafood. So there are some reasons to suspect that the lower limbs are more negatively affected. Of course, as a countermeasure, creatine and resistance training was shown to not only improve whole body lean tissue mass, but it also improved muscle quality below the knee and total body strength, or sorry, lower body strength as well. And we think that has applications for functionality later on in life. So for those listening and watching, I think you should always focus on resistance training from a whole body perspective, but please make sure you include lower body muscle groups quite often, because as we get older, we do go through age-related biological loss in those specific regions. What about, does it translate into functionality? Yes. What if we were to improve, leg press or squat strength in the lab? Does it actually mean anything to the average person when they go home? And very interesting when we did a small meta-analysis on sit to stand. So think of when you get off the toilet, when you get out of the bed, when you're getting out of a chair, it takes a lot of effort. At a young age, it's easy to do, but what about at an older age? And we look at the small handful of studies, creatine and again, resistance training improved sit to stand performance more than placebo. So again, now we're starting to see some functionality benefits with that lifestyle intervention. How does it work? Well, I'm not going to spend too much time here. All that's really important to note is that creatine is not an anabolic steroid. I think that's quite clear. It's an organic acid or a nitrogen-containing compound made up reactions from the amino acids arginine, glycine, and methionine, commonly found in many food products. But it's well documented. It increases many muscle anabolic processes. When creatine comes into your cell, it likes to take water with it, so it's very osmotic. It's based on the sodium linking with chloride. And so when creatine will enter your plasma membrane, or for those familiar with muscle, the sarcolemma, it sort of swells this area called the cytoplasm. And by doing so, it sort of stimulates a lot of really good things within the muscle environment that may help explain why a lot of individuals get an improvement in muscle size. So, for example, we now have evidence that creatine will increase IGF-1 protein content and expression. This is a main anabolic growth factor, which seems to turn on things called myogenic regulatory or transcription factors. These are proteins that do activate satellite cells. Satellite cells donate their nuclei to different areas of the muscle fiber, and that ideally increases the capacity for not only transcription, but the translation of muscle proteins. So creatine does not directly increase the rates of muscle protein synthesis, but it indirectly creates a whole anabolic environment, which we think could explain some of the muscle growth perspectives. Just as important, we think creatine has muscle catabolic processes, or more specifically, anti-catabolic processes. Creatine has now been shown in many avenues to decrease reactive oxidative species. It actually will basically prevent the expression of myostatin, or a muscle inhibitor. It increases phosphocreatine and glycogen content or expression. And so by having a decrease in reactive oxidative species, a decrease in inflammation, you inevitably get a decrease in muscle breakdown. So previously I mentioned you get an anabolic effect. Now you're getting a more muscle breakdown or a preservation effect. And at the end of the day, that might help explain why we typically see an increase in hypertrophy over time. I think for those that are interested, the anti-inflammatory effects of creatine are really becoming prevalent, especially when we get to brain. And this is really important to note, that the majority of the mechanisms from insulin-like growth factor all the way down to mTOR have all been established quite readily in younger individuals. Please note, this might be a bit of a surprise, but creatine does not directly increase the rates of muscle protein synthesis. Sadly, though, we have a long way to go with older adults understanding the mechanisms. We do know it increases creatine kinetics and high energy phosphate metabolism. But the question marks here for the rest, we just don't know, do these effects last and persist in older adults? So a lot more work needs to be done. So in summary, the evidence-based body of research suggests that creatine supplementation and resistance training will improve whole body lean tissue mass, regional limb muscle size. Again, that might be important for rehabilitation such as stroke or partial paralysis. Lower limb muscle density, mainly really important for offsetting the risk of falls. And then again, I put a star here by upper lower body strength. I think this is the greatest amount of evidence with creatine monohydrate that if someone is consuming this or taking more in the diet, they probably will get an increase in strength. And I think that's really important in North America. The lack of strength is the #1 reason you're placed in long-term care facilities. Switching to bone, and again, not a lot of people were familiar with the effects of creatine on bone mass or mineral mass, but from an aging adult perspective, it's crucial. We were very fortunate to do a few randomized control trials, and the effects here, and this is found in Medicine and Science and Sports and Exercise as open access. We wanted to look at the effects, almost a pilot study, looking at the effects of long-term weight training and creatine supplementation on bone mineral in postmenopausal females. And these were postmenopausal females for 12 months after their last menstrual cycle, not on hormone or estrogen replacement to any significant degree. A little bit of caution here on this study, a small sample size, but again, it's providing some evidence or a magnitude of effect for a larger randomized control trial, which we'll talk about shortly. Again, they were randomized to about 0.1 gram per kilogram, so on average about 8 grams a day. And they underwent 1 year of supervised resistance training. So we had certified personal trainers watch these females over time as well. And the results were quite interesting. When you look at bone mineral density, and now this is the change in the femoral neck or the hip region, and we measured this through DEXA. This is quite interesting that the group on creatine, they experienced a negative 1.2 reduction in bone mineral mass. In other words, they still had a reduction in bone mineral density around the hip region, but compared to placebo, it was a lot less. So we concluded that creatine attenuated or preserved bone mineral density around the hip compared to placebo. Placebo got a little bit of a dangerous result because -5% is clinically significant. So again, what this is showing is that the biological process of aging in postmenopausal females is accelerating. Resistance training has to be there because imagine if we had a group that did nothing. I bet you it would be maybe -10%. So again, catastrophic. Resistance training probably had a favorable effect. And again, the addition of creatine there as well. So nothing was above zero. We didn't improve bone mineral density, but creatine seemed to reduce the rate of bone mineral density loss. And that might have some clinical benefits later on in life. Some of the limitations to that study was a low sample size. And maybe the other thing is that maybe 1 year wasn't long enough to see some bone beneficial effects. So we tried to address this in a much longer term trial where we extended it to 2 years of exercise. And then this is interesting. We did do the 3 days a week of weight training, but we also engaged in 150 minutes of moderate aerobic exercise and brisk walk 6 days a week. We were very fortunate to get over 200 postmenopausal females. And again, we even thought maybe the dose in the last study wasn't long enough or high enough. Let's give a bit more. So now we gave the highest dose ever been given in a randomized control trial in healthy individuals. This is 0.14 gram per kilogram. So again, if you're 70 kilograms, do the math, you're almost getting about 9 grams. On average, our females were getting 11 grams a day for 2 consecutive years. And when we measure now bone strength, which has been indicated by the World Health Organization, again, the femoral neck, you'll see here it's a very interesting result. After even 2 years of creatine and resistance training, at best, creatine preserved bone strength in the hip region, whereas the individuals on placebo suffered a significant decrease from when they started to over time. So again, time isn't on our side, so to speak, with aging, but at least resistance training, walking, and creatine would help preserve bone strength. And I think that's something to consider. Another measure is buckling ratio. This is something you don't want. It's kind of like taking your pen or pencil and sort of cracking it. Picture that as your bone. That's not what we want. In the same group of individuals, creatine seemed to preserve buckling ratio. That means the bone didn't get weaker. Unfortunately, those on placebo, it looks like it did. So this simply means that those individuals could sort of break the bone maybe a little bit easier. So as they get older, maybe in the 7th or 8th decade, they might be more susceptible to fractures. We wanted to look now at a little bit more scientific measure of imaging. Remember, the previous study was looking at DEXA. We wanted to use PQCT. So it's a three-dimensional imager of bone, and that look at trabecular as well as cortical. So going back to that previous study where we looked at muscle density, again, 53 individuals, males and females, were taking about 8 grams of creatine a day. And this is quite interesting as well. When you look at the data, tibial shaft, or sorry, distal tibia and tibial shaft area. So again, the bones below the knee, similar to the muscle density, the individuals on creatine had a slight increase compared to a decrease on placebo. So again, you could favorably argue that creatine, yes, it's having some very small benefits, but I think the big take home is preserving or slightly increasing it, whereas those that are not on creatine are experiencing a decrease. So again, this has massive implications for those, especially older adults and primarily postmenopausal females that are more susceptible to age-related osteopenia and osteoporosis. We think this is considered clinically significant. It didn't reach any clinical significant levels, but we're getting there because bone strength and area are predictors of hip fracture. And of course, as on a global basis, hip fracture is a main cause of functional impairment. How it likely works, we think we have a good idea, very similar to muscle, but when creatine is added, excuse me, to osteoblast cells or the bone building cells, they seem to become energized. And of course, if they become energized, they sort of release a decoy, OPG or osteoprotogerin, which is a cytokine, but it inhibits osteoclasts or the bone resorptive type of cells to being activated. So in other words, when creatine is in combination with osteoblasts, they sort of decrease osteoclasts from being upregulated. And of course, if that's occurring, you get an increase in net bone accretion and a decrease in bone resorption. And we did a study in 2008 clearly showing that NTX is a measure of entyl peptides or a measure of collagen, about 40% of your bone. And so those individuals on creatine, it was about 8 grams again a day. And this was only a 10-week study, clearly showing that there is bone turnover, but those on creatine experience a 30% decrease compared to a small, non-significant increase for placebo. And again, the decrease here is good because that means we're having less collagen being produced in the urine. So at the end of the day, it seems to have a bone preservation effect. Indirectly, we think those previous studies showed that there was an increase in lean tissue or muscle mass from creatine. Maybe that's pulling on the bone throughout the day when you're exercising, performing activities of daily living, and that'll maybe help explain that the increase in lean tissue mass is correlated by a more preservation or a bone beneficial effect. So in summary, the combination of creatine supplementation, and please note here the dose. On average, is about 8 to 11 grams a day, much greater than the dose shown for muscle benefits. It can have some small favorable effects on bone area and geometry. It can decrease urinary measures of bone resorption, but please note we're really confident here that it does not increase bone mineral density. If you're going to notice any bone benefits, there's a select few studies that we went over that can have some small effects. Please note there's a vast body of research that does not support creatine's effect on bone, probably because those studies were shorter in duration or they use a lot lower dose. So if you're experiencing or wanting to experience any bone benefits, could be a population-based, but you're probably going to need to combine resistance training with a much higher dose. And finally, we get into some really exciting and emerging areas with the brain. And again, this organ, although it's only about 2 kilograms or 2% of total body mass, it uses about 20% of your energy demands per day. And please note, that would potentially even go up when you're metabolically stressed. So think of sleep deprivation, working overnight, jet lag, a student's cramming for a midterm. You wake up the next day, you're very foggy, you need a lot more coffee, for example. So again, whenever this organ is metabolically stressed, it utilizes creatine at a sufficient rate to maintain bioenergetics. So the theory here is that can creatine supplementation, just like to our muscle and potentially bone, if we can increase the amount in the brain, could that have any favorable effects? Now, the issue here is that unlike muscle, which acts as a vacuum, creatine in the brain is a little bit different. The brain has the blood-brain barrier, as we all know, and unfortunately, the most prominent glial cell, the astrocyte, does not have the ability to have the creatine transporter. So unfortunately, creatine has a blunted ability. It can get in through the oligodendrocytes or endothelial cells that are lining the capillaries. But unfortunately, the astrocytes, which are kind of acting as a really important filter, don't express that in humans. So therefore, the thought is that creatine has a blunted ability to get in past the blood-brain barrier and accumulate into the brain. There is evidence that it can. It only seems to improve brain creatine concentrations anywhere between 5 to maybe 10 to 15%, whereas muscle is about 20 to 40, so about half the amount. So the thought is maybe to accumulate in the brain, we need higher dosages or longer periods of supplementation. It is interesting, though, that remember the blood-brain barrier is unique, but when you compare children, adults, and elderly, and this study was elegantly done in Brazil with a leading research group, Hamilton Rothschild and Bruno Gualiano, they simply looked at 7 days of very high dose of creatine, and lo and behold, there was no differences between the groups, clearly showing that once creatine is into the brain, it potentially maintains it's trapped because it's a little bit larger when it's phosphorylated. Or this could also sort of substantiate that the brain makes its own creatine. So please note at the beginning of the lecture, I talked about the difference between muscle and brain. Unlike muscle, the brain will make its own creatine. So during times of normal sleep, you feel great. The brain does not rely on the peripheral circulation from the blood. It does not rely on supplementation. So therefore, if you're getting adequate sleep, feeling great, young individuals, not having any sleep issues, you're probably not going to experience any benefit from creatine. We think creatine will come to the rescue when the brain is metabolically stressed, and this could be due to sleep deprivation, hypoxia, or jet lag. We did a meta-analysis a few years ago looking at older adults and memory. And this is interesting because as we get older, we're more susceptible to impairments in organ function, and the brain is no different or can't escape that. And when we look at all the data, you'll notice that there's only a handful of studies, but I want to focus on older adults down here. They had the largest effect. So when you look at the subsequent studies that have come out, we're starting to now see that the effects on creatine with and without exercise might have some beneficial effects on memory and cognition. There is evidence in younger individuals, but there's also some emerging evidence in older adults. And of course, that's going to lead into more clinical populations such as dementia, Alzheimer's, and things like that. As it currently stands, we're not seeing a lot of great hope or promise for neurological conditions in older adults. I think that has a lot to do with the infancy of the studies, a small sample size, and again, hopefully this will occur or be a main focal point over time. So for those with ALS or Lou Gehrig's disease, we're not seeing any great beneficial effects there. Huntington's and Parkinson's, the body of research is mixed. We do see some improvements, primarily in animal models, but I think more large long-term scale studies need to be done in humans with Parkinson's and Huntington's. We don't see any great benefits at all in people with MS. Alzheimer's disease is currently unknown, including dementia, but those studies have started now in the United States. So the summary for the brain, this is where it gets a little bit tricky. You need about either 4 to 5 grams a day for several months, or on average about 10 to 20 grams a day for 7 or more days. And that can increase brain creatine levels. We don't know the effect really in older adults. Remember that one study that we showed out of Brazil was only for 7 days. And it has some potential ability to improve memory and cognition in older adults, but I think that's a very emerging and promising area. So I love this graph taken from a really good review article in 2019 by Amber Dolan. It's currently basically showing that if you look at preventative creatine supplementation, it might be a little hard for you to see, but here's your creatine pool in the brain. There's your reserve here, sufficient levels in the middle, and then insufficient. And if you suffer an acute stressor, bad night's sleep, you fly to Europe, whichever it is, you're a little bit jet lagged. If you have sufficient amounts of creatine in the brain, you can bring those levels down, but you're still sufficient. But if it's chronic stressors, and then those levels become insufficient, and if you take supplementation, therefore that might bring the levels back up to normal. So I can't stress this enough. For those individuals watching, getting adequate sleep, you exercise, you have no major chronic stressors, creatine supplementation is probably not going to cause any noticeable brain benefits. But for those that are watching that are chronically sleep deprived, do you have intermittent working patterns? You may start to notice that supplementation will get into the blood-brain barrier and cause a sufficient amount. And that seems to be the best lines of evidence. The best lines of evidence right now seem to be during sleep deprivation, where individuals are voluntarily sleep deprived, and then they're able to perform more cognition and memory tasks a little bit later on. So again, there's a little bit of a disconnect, but there is potential hope over time. So I want to acknowledge all my collaborators, again, AllsChem and Creapure and Creavialis. They're a really main form of creatine monohydrate, all the government funding agencies. I want to thank you for your time. Again, in summary, we looked at the effects of creatine on aging muscle, bone, and potentially brain. There's my handle at Instagram. So again, I want to thank you for your time.